Well, hi there, everyone, and thanks for attending the Wellness and Health Promotion Program webinar. My name's Emily Fox. I'm the Virtual Learning Admission Counselor here at HACC, Central Pennsylvania's Community College. Glad you're joining us today. And before we get started, please know the presenters are the only ones with microphone rights. However, we do encourage your participation and you're welcome to ask questions using the chat box. We will have a time for questions and answers at the end as well. So today you'll have the opportunity to learn about the new fully online Wellness and Health Promotion Associate degree here at HACC. To give you a little bit of a background on HACC, HACC has 5 campus locations in the central Pennsylvania area, and HACC actually stands for Harrisburg Area Community College, but more commonly we refer to ourselves as HACC, Central Pennsylvania's Community College, because we reach so much further than just the Harrisburg area. So you can see we have campus locations in Gettysburg, Harrisburg, Lancaster, Lebanon, and York, as well as virtual learning options which can be done essentially from anywhere in the world. The Wellness and Health Promotion Program is offered fully online. If you were hoping to do any of the courses on a campus, some of the general education courses will be offered on the physical campus locations, but the complete program is available solely online. Joining me today for the webinar is Sandra Croft, Assistant Professor of Exercise Science, Health and Physical Education, who developed this new Wellness and Health Promotion program here at HACC. And to give you a brief background on her education and her work experience, Sandra has her master's degree in health promotion, and she spent several years working as the wellness director at a large retirement community where she developed and managed wellness programs and facilities for over 2,000 residents and 1,500 employees. Sandra has also taught as an adjunct professor here at HACC for 10 years, and she accepted a full-time online teaching position with HACC in 2015. Sandra really finds a passion in empowering others to reach their highest potential, and she looks forward to creating new opportunities for students to not only change their lives, but also the lives of others by facilitating behavior change and promoting health and wellness for life. Sandra has poured many hours of hard work into the creation of the Wellness and Health Promotion Program, and I'm glad that you will hear from her today to find out more details about the new exciting program starting at HACC in the fall, in the Wellness and Health Promotion Program. Sandra, I'd like to turn the program over to you.
Thank you, Emily. Thank you for this opportunity to introduce our new program. And let's get started by first defining wellness. This definition that we have is from the National Wellness Institute, and I really think it's important to start with this definition because currently there are lots of different ways that the term wellness is used. So in terms of our program, we're looking at this as a wellness being a conscious, self-directed and evolving process of an individual achieving full potential. It's multidimensional, and the graphic there is a good example of the many different dimensions of wellness that are involved, and it's a holistic approach. And it's both positive and affirming, and wellness, of course, builds on the strengths of individuals and also the strengths of communities. And again, this definition is from the National Wellness Institute, which is a national accreditation body. And then if we define health promotion is any planned combination of educational, political, environmental, regulatory, or organizational mechanisms that support actions and conditions of living conducive to the health of individuals, groups, and communities. And this definition is from the Joint Committee on Health Education and Promotion Terminology. So really those two terms, wellness and health promotion, that lays the foundation or the framework for our program. Now Now you might ask yourself, why should we study wellness, or why is it important to study wellness and health promotion? Well, currently in our country, we have an aging population and workforce. We also have increases in obesity rates, heart disease, and diabetes. This results in an economic burden on our healthcare system, and that necessitates the need for quality wellness and health promotion programming. And of course, this need has been recognized by our nation and by our government. And 5 years ago, the Surgeon General released what is known as the National Prevention Strategy. So this was back in 2011. And this National Prevention Strategy is a guide to promoting health and wellness and improving the lives of all Americans. And at the center of this strategy is to increase the number of Americans who are healthy at every stage of life. So being healthy at every stage of life. And we can achieve this goal through establishing healthy communities and safe communities and environments, and also providing access to clinical and community preventive services, eliminating health disparities, and empowering people. And we can do that through meeting objectives such as injury and violence-free living, tobacco-free living, preventing drug abuse and excessive alcohol use, healthy eating, active living, mental and emotional well-being, and reproductive and sexual health. And then we also have another national strategy. This is another national health promotion strategy known as Healthy People. And currently we fall under Healthy People 2020. Healthy People provides a science-based 10-year national objectives and goals for improving the health of all. And the vision for Healthy People 2020 is a society in which all people live long and healthy lives. So despite the evidence and value of both health and wellness, only a handful of undergraduate programs currently exist to develop a qualified workforce to lead the charge for a healthier America. So not very many programs out there right now that the focus is on both health and wellness. And that really was the driving force behind the creation of this program. So just to give you some more specifics about our program here at HACC, the Wellness and Health Promotion Program is an Associate's in Applied Science. It is a career. It is classified as a career program, and it features 62 credits that are available 100% online. And students will have 2 program options to choose from, one of which is workplace wellness, the other is community health. And both of those options will be available starting this fall, 2016. And to just give you a little more detail about the 2 different options to students, workplace wellness is going to focus on designing and implementing wellness and health promotion programs for both employers and employees. The focus, of course, is on healthy behaviors in the workplace and improving employee health outcomes. Community health is going to focus really on health advocacy, or health advocates working through health agencies and healthcare systems. Those advocates are going to connect with individuals to services and resources they need, and of course promote a healthier community. And we take a look at the courses in the program. There are general education credits along with program courses. Those general education credits are going to feature English, communications, psychology, math, and in particular a course in statistics, humanities and art choices, gerontology, biology, physical education and wellness, project management, and marketing. And then we can take a closer look here at the courses that are available in the major. The courses that, for this curriculum, the courses that were developed for this curriculum, we worked very closely with a focus group, or what we call a DACM panelist, and these are wellness professionals that are currently working in the field. And we based a curriculum on what they felt were the skills and the knowledge necessary to be a qualified professional upon graduation. So that's how we work to design the curriculum. So the courses in the major, the very first course is Wellness and Health Promotion 101. That's Introduction to Wellness and Health Promotion. And then approaches to weight management, approaches to stress management, health behavior change and interventions, foundations of health coaching, wellness program planning, implementation, and evaluation, concepts of workplace wellness, and concepts of community health. And then it ends with a wellness and health promotion capstone course. Each of the courses in the major are 3 credits, and we have a link listed there under the web links. We have a link listed there for you if you'd like to check out those course descriptions. So you can go to the HACC website there, and you can see each of the courses here in the major that have a description. Just to tell you a little bit about some of the basics in the course, I'll cover what some of the curriculum, what that looks like on the next slide. But to just tell you a little bit about concepts of workplace wellness and concepts of community health. This is taking a closer look, a focus on those 2 different options in the program. And both of those courses, students will have the opportunity to have a field experience. So we're excited about that and the collaborations and the partnerships that we're going to make through those courses. And then also the capstone, the students will implement a workplace wellness project or a community health project, depending on the option they have chosen. And then also the capstone will feature a post-graduation plan that students work on, and they will work very closely with our Career Services Department to complete that project. So the curriculum will prepare students to critique scientific literature and health-related information, which is really important these days with lots of health-related information on the internet. We want to be able to discern what is quality information. Also assess individuals, programs, populations, and communities. Facilitate behavior change and lifestyle modifications. And connect resources to individuals and communities. Demonstrate health coaching skills, and design, implement, and evaluate wellness programs. And something that's really rather unique to our program and unique to our curriculum is a health coaching philosophy that we will have that's going to be weaved in the courses, but then also there will be a specific health coaching course. And the health coaching philosophy, this is a bit of a mind shift for a lot of folks. And if we think of it from a client or a patient perspective, oftentimes with health-related changes, folks think that they can just show up and say, okay, tell me what I need to do. And what we've learned in behavior change is it doesn't always work when someone approaches from that direction. So it's really important with health coaching. It's important for folks to understand that this is more of when you're seeing a health and wellness professional, they really are an ally for you. And there's a great metaphor out there. It's called the mountain guide metaphor for health coaching. And this is to view that health and wellness professional as a mountain guide. And so you show up to see them, and they are to help you and work alongside you in your efforts to climb a mountain. So they're not going to climb it for you. They did not supply the motivation for you to climb it. That motivation came from within, and you have found yourself in a place where you are ready to climb a mountain, and your health coach or your wellness and health promotion professional is there to help guide you. So they help work alongside with you and help you establish the goals that you have for climbing your mountain. They help establish and connect you to the resources you might need, and they're there with you each step of the way until you reach the summit. And our program graduates, our students, once they complete the program, are encouraged and are prepared for a health coach certification. Okay, lots of career opportunities. Some of the job titles that we anticipate for students upon graduation would be health educator or advocate, wellness or health coach, workplace wellness coordinator, community health worker or specialist, behavior modification specialist, health promotion specialist, community engagement specialist, or prevention specialist. The career outlook at this time is very good. Jobs for health educators, wellness coordinators, and community health workers are projected to grow 13% from 2014 to 2024, and that's classified as a faster than average growth rate for all occupations. And those statistics are from the Bureau of Labor Statistics. And so the various settings where a wellness and health promotion professional may work, a whole list of options here, healthcare systems, hospitals, doctors' offices, corporations, private businesses, nonprofit organizations, government, military, schools, colleges, and universities. Okay, so that's really the basics for our program, and I'd like at this time to turn it back over to Emily so that she can introduce our guests, our professionals that we have that are working in both workplace wellness and in community health. Thank you.
Thank you, Sandra, and you did a great job of providing an overview of what the Wellness and Health Promotion Program at HACC entails. The analogy of a mountain, I think, captures it very well, but this is truly an exciting program that's coming in the fall. There's lots of potential in the job field, and I know that you touched on some career opportunities, but as you mentioned, joining us in the webinar today are individuals who currently work in the field. So I'd like to introduce our first guest. I'd like to introduce to you Ginger Miller. She works as the Health and Wellness Coordinator for HACC Quality Food Incorporation, where she creates programs and provides resources for the 2,700 nationwide employee base as well as their families. Ginger also serves as a vice president of the HACC Women's Mentoring Group, and her education was obtained from Elizabethtown College in the occupational therapy program. And as a Pennsylvania licensed occupational therapist, she did work in the rehab and home health setting for many years before coming to HACC, where she works currently as the Health and Wellness Coordinator. So Ginger, we'd love for you to share more about your experience, about your story, and I'll pass the program to you.
Wonderful. Good afternoon, and thank you, Emily, for that introduction. I'm really excited to be here with you guys today, to be a part of this growing field of health and wellness, and to share some of my experiences, especially my past 3 years of experiences here at HACC Quality Foods. I thought it would be valuable to, first off, provide you with a little of what I saw on the so-called sick end of the health spectrum and the early part of my career, which kind of leads into what I'm doing in the health and wellness career at HACC, and give you my perspective of health and wellness career as it relates to the worksite wellness and the different business models. As an occupational therapist, I work toward rehabilitating individuals who have been through different things such as surgeries and injuries, strokes, and other debilitating medical conditions. More often than not, though, I would not only be treating the more acute injury or a condition which led to those hospitalizations and ultimately that rehab, but I was looking at an accumulation of other issues which frequently limited people's progress and were actually underlying reasons which led people to their issues at hand. For instance, I'd see somebody maybe who had an amputation because they had an out-of-control diabetes or chronic obstructive pulmonary disease from smoking, or perhaps a stroke from having high blood pressure. I frequently saw individuals who had fallen because they had a loss of strength or dehydration, and the list goes on and on. Oftentimes in the skilled nursing and rehab sector, you will find people returning after they were discharged to home, so they make all this great progress, but they go back to their homes only to find that they really didn't change their lifestyles. So I try to make it a goal of mine to not only fix the problems, but to look at the whole lifestyle that my patients were living and send them home with the resources, the education, modifications that they needed to create healthier patterns. I learned over the years that was not enough to give a patient a home exercise program and equipment in order to get them to be more independent and self-sufficient, and to keep them from going back into the hospital. But we also had to address the safety and medication adherence and nutrition. Sometimes I had to address managing finances and stress reduction. It was important to not limit my scope of rehab to just the injury or the debility, but to focus on the well-being of the person as a whole and find out what goals were important to them. And that's where I brought my background into what I'm currently doing at HACC. So 3 years ago, the executive team at HACC took a look at the rising costs of healthcare in this self-insured organization of 2,700 employees. And historically, HACC had intermittent wellness interventions, such as the HR-run weight loss competition and lunch and learns. But the CEO of HACC decided that rather than be complacent and just pay the bills for a growing population was not being proactive enough. And he really wanted to get in there and have a more aggressive approach. Most of the associates had the misconception that the insurance company paid all the bills for healthcare and that healthcare costs are really not a burden to us. But our CEO proceeded with a series of letters and memos telling the story of the rising healthcare costs and the deteriorating health in our nation. At that time, he made this commitment to not only put new resources and programs in place at HACC, but to develop a culture of health and wellness at HACC. And this is where I stepped into the picture and came into play. HACC actually took this time to create a position just dedicated to this program. And that's the position that I'm currently in as Health and Wellness Coordinator. Now, oftentimes you see businesses trying to do this with a team of HR professionals to establish wellness committees to develop healthy challenges and programs and even find incentives to incentivize healthy behaviors related to nutrition and exercise, which is really a great start and a good mindset. But depending on the population, the draw in participants is not always that crowd you really want to target or engage. They're kind of already the ones that are doing the right thing. It's great to keep them involved and engaged, but there was another grouping of people we really wanted to address. And sometimes, depending on those programs you created, they may be short-lived as well. So the value of having a designated position like this to lead the charge in health and wellness is not only to create uplifting and trending health and wellness programs, but to make those programs more relevant to the population and really identify champions along the way to infiltrate the organization with the positive health and wellness themes. So where to start from here? At HACC, we decided that in order to make programs more relevant, we would need to look at the health needs of our population. So we started to offer free biometric screenings. So this was just the starting foundation of our program. So we offered biometric screenings and health risk assessments to our associates, which really provide valuable information to us as an employer in an aggregate format. It allows employees to know their numbers and where their health risks lie. Due to HIPAA laws and such, we really didn't know individually what each employee's numbers would be, but we had an aggregate reporting, and we could see some information based on locations. You'd be surprised, though, how many of these individuals had not seen a doctor in years and learned some very discerning information during our first year of offering these screenings. In addition, we took a look at medical claims data, which shows if our employees are taking care of their preventative care needs or if we have a specific chronic disease category that sticks out. We were looking at any trends or things that we could impact with our health and wellness program. Because we are located nationwide, we can analyze this information by location and, again, determine what programs and resources are most needed by area. So for instance, we may see an increase in smokers in one area where we may offer more aggressive smoking cessation programs, while in another area, there might be more evidence of very high BMIs or diabetes. We may have more on-site weight management programs or diabetes education programs in these locations. If there is a run on a particular maybe musculoskeletal issue, back injuries or such within a work environment, that we address with thorough body mechanics training, stretching programs, or we might have to take a serious look at modifications to workstations even. Further assessments are occasionally completed through employee surveys, which is very important. This gauges interests and perceived health and wellness needs from our employees so that we can get an idea of what would motivate and engage these people. It doesn't make sense if you don't offer incentives or programs that are meaningful to people, or if you don't hold those programs at times that are convenient for employees. Of course, consistency in gathering and reassessing health numbers, claims information, employee feedback, your program participation number, responses to your various incentives, it's all imperative so that we know what we are doing is right and where we need to focus further. At HACC, I manage and perform orientations to our 3,000 square foot gym, which is open 24/7 to our full-time employees and their spouses, but I'm not the personal trainer for these 1,700 people. I just give some initial guidance. I have instructors that come in who teach boot camp and Zumba and yoga. We have a Weight Watchers program at work, a tobacco cessation class, weight management classes, nutrition classes, diabetes management classes, in addition to lunch and learns on topics including sun and skin protection, stress management, importance of immunizations. We offer on-site flu shot clinics and lifestyle change awards and multiple challenges and competitions. A quarterly health and wellness publication spotlights our successes of our associates and educates them on health conditions and reminds them of upcoming events, as well as resources that are available to them. Our CEO has always been big on sharing testimonials, whether about accomplishments or what resources have worked for someone. I also facilitate an online health management system between a vendor and our employees. And this system allows employees to track their health numbers from year to year and gives a central location for everyone to track and earn some wellness points for meeting their health metrics or attending yearly preventative care services or engaging in healthy activities such as our UTS Run programs, online courses, programs, and challenges. So this gives a means to track wellness points for all nationwide associates in order to offer health plan incentives as well as some cash incentives along the line. But prior to this position, I would have never considered the communication challenges that I would have been faced with. 2,700 employees, you can just imagine all the forms of communication in order to try to get through to people. I assumed that if you planned it, they would come. It would all be fun and enlightening. The employees of us have lots of free tools and resources at their disposal, which can address many of their health and wellness needs, but the value often gets lost in the means of communication. With a very diverse workforce ranging from manufacturing to route sales, tractor-trailer drivers, to administrative types of positions, we cannot always depend on an email blast, a newsletter, a posting to get in front of someone. We have several different languages spoken amongst employees in a wide range of ages, educational backgrounds, social and cultural considerations when we try to strategize the best means of communication and how to educate and motivate our associates to live healthier lives. But of course, I find the best form of communication is that one-on-one, which is often difficult, again, with those 2,700 people. So if we can get to those middle-level management positions and really educate them, they can take the word out to their people as well. When I was hired, there was this perception that I was the person who was running the gym and who managed the annual Shape Up UTS competition. To many, health and wellness was just about exercise and nutrition. My job is to consider, though, the many components or dimensions of wellness that do exist. And I think you'll see a lot of this in the HACC curriculum that's being introduced. What is causing employee stress, and look at creating better balance in their lives. I can't tell you how many times an employee comes into my office looking for an answer to a health issue, and we end up identifying multiple underlying factors for that issue, whether it be some mental health issues or financial burdens, non-compliance with their medications, nutrition, or just figuring out how to organize their life and take care of all their personal needs and their family needs. For as much as I personally love being healthy and eating healthy and creating fun and interesting programs that I think everyone will participate in, I always have to keep things in perspective as to whether they are truly making a difference and accomplishing a goal, or do they just look good from the outside, but not really impacting the health of our population. Without a true understanding of the population's health and the culture of the business, a health and wellness program in the worksite cannot be sustained or justified. As a health and wellness coordinator, I don't want to be back where I was as that occupational therapist after the fact, treating the sick and injured. I need to know where the health of the population stands currently and anticipate where the health of the population is headed. I want to be at the forefront, encouraging healthy lifestyles and infusing wellness into the daily grind of the job, while finding out what appeals to people and really what motivates them. In this position, I'm not just a glorified activities director. I have to wear numerous hats. I'm a data analyst, I'm a coach, a cheerleader, a facilitator, and a resource. Although I personally am not perfect, I also have to be a role model for healthy behaviors, while letting people know that I do have flaws and obstacles myself. And yes, working for UTS, I do like cheese balls that we produce here. I'm not going to judge and watch what they eat in the break room or yell at them to work harder in the gym. And I'm not going to look down on them for not being where someone else is or where I think they could be. I have to keep a sense of humor, but know when to be extra compassionate and sensitive. People spend many hours of their life on the job, so integrating wellness in the workplace just makes sense. Being marketable for a position in this field takes personality, but it also takes knowledge to be strategic and a bit data-driven. A business wants someone with enthusiasm for wellness, but there is also a bottom line to consider. Even though you may not be a business person or financial person by education, which I certainly was not, you need to remain well-read and educated on many subject matters, but still never lose the passion for healthy living. I think this is a fantastic progressive field, and you can really make it your own and make it evolve, but the education and the knowledge that you would get from curriculum such as this, coming from HACC, is very, very valuable. And it's very, very necessary in order to sustain the changes in health and the healthcare system as we see these changes in the future. So that's a little bit about my story, the start in the occupational therapy field, my introduction to worksite wellness at UTS, and my perception of where worksite wellness fits into the whole picture. I definitely did not come from the background that we're looking at right now of, hey, I'm going to go to school for health and wellness, but it's evolved into this, and I think it's great programming.
Thanks for sharing, Ginger, and I picked up on a number of items that you shared that I think are very key. I love to hear of the variety of initiatives that are going on there in your workplace, and I commend your workplace on having a very proactive approach and establishing that culture of health and wellness. I think many more organizations are moving in that direction and realizing the benefit that it really does offer. Also, like how you mentioned the relevancy of meeting individuals where they are by using the screenings and even tailoring it to a specific location to make it relevant. So thanks for sharing about your experience and your perspective. That was very helpful, and I think gives the individuals in attendance here in the webinar a picture of what a career could look like in the wellness and health promotion field. So thank you, Ginger. I would like to move on in the program and introduce another individual who works in the health and wellness field. With us today we have Enyance Eugene Godono, who's a community health worker for Temple University Hospital. Eugene has an associate degree in computer science and a bachelor's degree in business administration. And what I really like about Eugene is he had the passion to help and teach early on at a young age in his community in Africa to many of his friends who were unable to go to school to get education. So Eugene, we'd love to hear more from you.
Hi, everybody. So, as she mentioned, my name is Inyans, but everybody call me Eugene, which is my middle name. So I'm the lead community health worker at Temple University Hospital. And I will start by giving I would say a basic definition of community health worker. There's a lot of definition out there, but the basic one, I would say, a community health worker is a frontline public health worker who is a trusted member of the community. So by saying that, it's like we work closely with the community, which means sometimes we live in that community, or sometimes we just have some kind of similarity with the community, or we just have passion to help the community. It don't have to be necessary that someone who live there with the community. A CHW can learn about the community, their needs, and help them accordingly. So to start, I would say at Temple University, when the program started about, I would say 3 to 4 years ago, we have only, at that time, it was only one community health worker. And the focus at that time supposed to be just to help patients who has a heart failure disease. So, but the demand started to grow. So the hospital decided to hire more CHW, which is the community health worker. So to be brief, right now we have, at the main hospital, we have about 12 community health workers. And really what we do is to help and assist patients who have social barriers to clinical success and help them through the transition from the hospital to home, to primary care, and to specialty care. So I will just give you some example. We sometimes get patients that came to the hospital and get admitted, treated, get better, and get discharged home. So what we do to help them is, while the patient is inpatient, we try to connect with the patient. So we visit the patient, we did our initial intake, we explain to them how we can help them. So when they get discharged, most of the time when they're in the hospital, they have the case manager and the social worker who assist them. But once they get home, most of the time they have nobody. So we do a home visit. We visit the patient. Our goal is to do the home visit the first week after the patient gets discharged. We visit the patient. We try to do some kind of assessment to see what they have in the house and what they need help with. So in the majority, you see the patient, they're entitled of a lot of resources that is available to them, but they just don't know that they have that resources. So we try to connect them with the resources. It can be to connect the patient with food stamp, or it can be to connect the patient to make sure the patient get a right health insurance, or sometimes transportation. So there's a lot of stuff there that we help the patient. So for example, and I will give you just one case scenario, that one patient that I'm still working with. So this lady, when I first met her, I got a referral from one of the case manager from the hospital when she was inpatient. So what triggered the case manager really to send the referral to our program is she realized that the patient get 3 admission within 1 month. She came, treated, go back home, and the following week she will come back again because she's sick. So she referred the patient to our program. So I met the patient, I did the intake. After the patient get discharged, I did a home visit. So when I did the home visit, I realized that this patient, whenever she get discharged, she went back home, she never follow up. So to be brief, I'll tell you, like, that patient, before I met her, she don't have a primary care, or I would say she stopped seeing her primary care doctor for more than 5 years. So there's nobody really that's following up after she get discharged from the hospital. And also the medication she get prescribed, she never went to the pharmacy to pick the medicine. So she just go home, and after a couple days she gets sick and she came back to the hospital. So when I met her, I asked her, like, if she allowed me to go through all her medicine that she have in the house. So she bring a bag, and in the bag there's medicine that are since like 1998, and they just here, and whenever she feels sick, like whatever she can grab, and she just think that may help her, she just take that medicine. So I asked her, who's your primary doctor? She told me she used to go to the health center, but one time she went there, she wasn't satisfied with the treatment, and she just stopped. And I asked her how long. She said like more than 5 years. So I convinced her, and she accepted, so that I can reconnect her with another primary doctor. She has the insurance, but she just don't know. She thinks she has to go to the health center. That's why she never tried to get another doctor. So I explained to her that she can get another doctor at Temple Hospital. So she agreed. I connect her with a new primary doctor. And at that time, in our program, we sometimes work with the pharmacy student, a student who are about to graduate to become doctors in pharmacy. So we work with them. So at that time, we have a couple of students that are working with us. So I took one with me. So that student was able to go over all the medication, and we realized that really that patient wasn't taking none of the medication that are related to the disease that she's having. So we make a list, and we connect her with another pharmacy. We call the pharmacy. They arrange all her medication that same day. We went to the pharmacy, we get the medicine, we came back to her house. The student show her how to take the medicine, sorry. And it was really a big challenge at that time because she just think that's too much for her. So we start working with that patient. After 2 weeks, we arrange a follow-up with a new primary doctor. So we asked her to come with all the medicine. She came, the doctor re-educated her again and did all the blood work, everything, because for the last 5 years, she never had a blood work. She just don't know what's going on with her. So this is just like a brief, like I can tell you the story for the whole day for this patient. So to make it short, I'll tell you that right now this patient is really doing very, very good. Like for the last 6 months, she didn't get admitted. And one of the challenges that this patient is facing right now, that's the reason I still didn't close her case, is she never tell the doctor that she cannot read. So whenever she went to see the doctor, they give her the discharge instruction. they ask her, like, if you go home, read this or did this, she would just say, okay. But she came open because she trusts me, so she tell me the truth that she cannot read none of this stuff. So now we work with the student at that time, and we design something that she will be able to know her medicine. And after that, we send her to another pharmacy that do blister pack. So now all her medicine came in a pack, and she just know how to take it. And I'm really like in the process of closing her case now, because she become very independent. She even call me sometimes just to check on me to see how I'm doing. So this is just one example of really what whoever want to become a community health worker, this is the kind of thing we do. And really it depends also of the organization where you work. We also have a community health worker that work here at the hospital and at the call center. And any patient who get discharged from the hospital receive a call from them just to follow up to make sure they have a visiting nurse to make sure they get the medicine. And if there's any concern, we're lucky to have about 5 nurse navigators in our team. So if there's anything that's related to medication or some health issue, we don't give advice as a community health worker. We connect this patient with our nurse navigator, and sometimes we make them appointment to come back to see their primary doctor or any specialty doctor that they need to see. So to kind of summarize it, I would just say to be a community health worker is not really like something that you can just say, oh, I want it as a job. You have to have the passion, you have to have the competency, and you just have to have the willingness to help people. If not, really, you cannot do it. It's something that is very rewarding. You're going to find someone who has no family, nobody. You become an extended family for these people. You help them. You connect them with resources. So at the end of the day, you become just part of their family. We have a lot of patients that we work with. Even though we close the case, sometimes they're still calling us just to check on us. And if they have another problem and they call us, we still open the case and help them. So, and I would say for the way we serve patients is really not to make them depend on us. We're trying to teach them so that they can learn how to do all the stuff for themselves. We advocate for them at the beginning, and we teach them how to advocate. And we provide social services and resources. We help them with appointment reminder. We show them how to call and make their own appointment at the future. We show them like how to call their primary doctor and tell their concerns so that they don't have to go directly to the emergency room. And also we assist them in brief, like just to navigate of the health system. So that's just some of the point, the way we help them. And as I mentioned in the example I gave you, like we really don't give any medical advice. We try to connect them with our nurse navigator or the doctors. So we more focus on the social barriers. So I will kind of leave it that way, and we can take questions if you have any questions about what we're doing. And I know when I start, I mentioned that we take meeting the patient as inpatient. So now the program has grown so big that we take the patient even as outpatient when, for example, a patient came to see the cardiologist and the doctor realized that there's a lot of social barriers. So the doctor make the referral to our program. So now we met the patient even as outpatient. That's like the program keep growing, so we really don't have limit now. And thank you for listening, and I'll wait for any question that you may have.
Yes, thanks for sharing, Eugene. And maybe there is a question here, actually. It looks like, does Temple University Health get paid from Medicaid or Medicare? Eugene, if you would like to answer that, since that's specifically directed to you, please go for it.
And can you please repeat the question?
The question
Hello?
was, and you can see it there in the chat box as well, from Jamie there, does Temple University Health get paid from Medicaid or Medicare?
So this is like more administrative question that I will not be able to answer, but I would say that Temple University Hospital is taking patient that has Medicare as and Medicare as insurance. So indirectly, I would say yes, we help this kind of patient. And if I answer it in another way, I would not say that we charge the patient because they have a community health worker working with them. No, Temple University Hospital is paying the community health worker. We are employed by the hospital.
Great, thank you. And Eugene, thanks for sharing about your experience too. One thing that I picked up on is you started with one community worker and now you have over 12 community workers, which is saying there truly is a need in the field for this type of position. I also liked your example of a patient that you were helping them transition, providing them with resources, and with the example that you gave, it was a seemingly simple issue that the individual was dealing with, but it was causing a big obstacle and challenge in her life, and you were able to help and really pour your passion into your job. So thanks for sharing your experience with us, Eugene. We will take some questions at the end as well, but I would like to move on here in the program. Now that you have an overview of the Wellness and Health Promotion Program here at HACC, you've also heard from professionals in the field. Perhaps this is a program that you're interested in pursuing further, so I'd like to share some more specific information about HACC if you do plan to pursue it. I'll share some resources that are available at HACC, and please know there are many resources available. I'm just highlighting a few. Also keep in mind that even though the program is offered fully online, if you're close to one of our campus locations in central Pennsylvania, you're more than welcome to come onto the campus and use any of the resources available there. So I'd like to go through some of these different resources here. The first two that you see listed, the sample course and also the self-assessment, are geared more towards individuals that are trying to figure out if online learning is a good fit for you. And to know where to access these various resources, on the right-hand side of the page at the bottom, you'll see some web links that you can go to access what I'm talking about here. So the sample course, you can see listed there under the web links. If you use HACC Student as both the username and the password, you can enter into our learning management system and see what it's like to take a quiz or post on a discussion board or submit an assignment through Dropbox. Lots of different things that you can give a try. Also, the self-assessment is available on our webpage, which is 20 questions, yes or no, which you can go through and determine if online learning may be a good fit for you. Some other resources, tutoring. We have tutoring available online through Smart Thinking. You can access it 24/7. So online learning is flexible. We have students that may be doing their coursework at 2 a.m. in the morning, and if you need someone to turn to for assistance, we're here to support you with tutoring through Smart Thinking. Another resource I'd like to point out is iTunes U Courses and Collections. HACC, along with 5 other institutions, MIT, Yale, Stanford, Duke, and the Open University, started offering courses and collections through iTunes U in 2012, which are free, not for credit, but great way to supplement your learning or even just learn about a specific area. So you can check out iTunes U Courses and Collections. Another resource is our career services, either on campus, there are resources online. A specific career services that I would like to point out to you is Career Coach, which is listed there in the web links. You can click on Career Coach and search the Wellness and Health Promotion Program to see what types of jobs generate here in the central Pennsylvania area, what are their salaries like, what is the demand, how many people are expected to retire. So I would encourage you to check out Career Coach. Two other resources I'll talk about. The Student Resource Center and Lounge is something that we have within our learning management system. So when you're logging into your online course, within that system is the Student Resource Center and Lounge, where you can go, ask any questions that you may have, any comments that you may have. We have staff, faculty, and students that monitor the questions and comments that come in. So you don't have to feel isolated going through an online program. There are many students around you and support around you to help you as you go through the journey. The last resource I'll talk about, there are many different clubs available through HACC. A specific one for virtual learning students is the Virtual Learning Student Advisory Council, which is essentially the student government association for virtual learning students. So if you are deciding to come to HACC, that may be a great club for you to become involved with. So those are some of the resources. I would also like to review the steps to admission, and feel free to email me at ejfox@hacc.edu for more details, or if you do have further questions as you're going through the steps to admission. But the first step is to apply online at hacc.edu/apply. Free to apply, and you can do so today. We also encourage students to go and fill out their free application for federal student aid, which is also known as the FAFSA. You can do so at fafsa.gov. If you're looking to get any type of financial aid or scholarships, loans, grants, anything like that, that is your first step by filling out the FAFSA. After doing the FAFSA in your application, students go through placement testing in the areas of math, reading, and writing to determine what will be the best course or courses for you to start at. So it's not pass or fail. It's not timed either, but usually it takes students about 2 hours to go through it. And placement testing is available on any one of our campus locations as well as online. After placement testing, students then go through new student orientation. If you're planning to take 100% online courses at HACC, you can access the online new student orientation in your My HACC account. And then from there, students will work very closely with our success coach, Deb Redman. You can see her contact information here on the slide. You'll reach out to her. She'll help you register for courses. And also throughout your time of being a student, she's there to support you with your various needs. After working with Deb to register for courses, students pay tuition, and for the 2016-2017 school year, it's if you are in a non-sponsored in-state school district, it's $259.50 per credit. If you're out of the state of Pennsylvania, it's $307.50 per credit. So we do strive to be affordable here at HACC, but also quality education. And then as a last step, I don't have it listed here, but we do recommend that students attend a Jumpstart Your Success event on a campus through a webinar or even the recording that we have on our webpage, just to receive some helpful tips and information for starting out as a successful virtual learning student at HACC. Typically, you can look to see when those events will be held on our webpage at hacc.edu/jumpstart. I do also want you to be aware that Sandra and myself, Emily, will be holding a Twitter chat on Tuesday, April 19th at 12 p.m. Whether you're new to Twitter or not, we would love for you to attend the 30-minute chat. You can ask any questions that you may have. You can also find out more about the Wellness and Health Promotion Program. So hopefully you can save that date and attend the Twitter chat that's coming up next week. I know you've been given a lot of information about HACC, about the Wellness and Health Promotion Program. You also heard from 2 individuals in the field, and I hope that you did find it to be helpful. On this slide here, you'll see Sandra's contact information, as well as Emily, myself, my contact information. Feel free to reach out to us if you do have further questions, but we do want to open it up to see if there are any questions among the participants today in the webinar. So if you do have some questions, feel free to type it there in the chat box. And Deb, it looks like you commented there in the chat, and I'm glad that you mentioned it, that you'll be sharing some advising responsibilities along with Sandra, and we're glad to have you on board with assisting the students. While I'm waiting to see if there are any questions that are coming up, I'd like to thank all of the presenters. Thanks to Sandra, thanks to Ginger, thanks to Eugene. I really appreciate your contributions today during the webinar. I do also want you to know, as a student, if you're looking to start with HACC, new student registration is underway for the fall term, and many of the courses will begin on August 29th. So you're right at the perfect time where you can be starting the application and admission steps. And if you do have any questions, you're welcome to reach out to me. Thank you for your kind words. Glad you enjoyed the presentation today. We will stick around in case there are any additional questions, but I do thank you for attending the Wellness and Health Promotion webinar today. Best wishes to you. We're here to support you, and feel free to reach out.